Hey guys, we're here with Preston. He's got some rotator cuff issues with his left shoulder. So we've gotten one treatment in and he's about 80% improved. So we hit his supraspinatus, infraspinatus, his AC joint, and interarticular. So he's got a little bit of irritation when he's playing basketball, but for the most part, it's better. During physical exam, he's got a little bit of inflammation inside his joint capsule itself. So we got PRP over here. PRP is going to be platelet-rich plasma. We're going to inject that back into the joint space and into the tendons. 50% dextrose. This is 2% lidocaine. It's going to be prolotherapy. 50% dextrose is actually inflammatory to the joint. So we're going to do this in combination with PRP. The lidocaine acts as an anesthetic to the joint, so it's going to numb them up. PRP is a little viscous, so it feels like olive oil. So Preston can probably tell you guys, like, it hurts a little bit. So he might have to have someone hold his hand, so you might see that, but overall, Preston is in good hands. So Preston, in the first couple weeks, he didn't really see that much improvement. And then about maybe 4 weeks in, he saw a significant amount of improvement. So some people get better quickly, some people don't. The downtime of soreness is usually about 1 to 3 days. How many days? Max.
Yeah.
Max 3 days. And then after that, it gets back to normal. Normal soreness, normal movements. And then after that, you'll start seeing improvements either a week, 2 weeks, 3 weeks, 4 weeks. But your downtime isn't like a surgery where you're out for like months. How's the recovery process for you?
It's been great.
Usually what I tell patients to do as well, you do a lot of contrast hydrotherapy. It's an inflammatory procedure. So you're actually causing inflammation. That's why his soreness is gonna happen for 1 to 3 days. So he'll use 20 minutes of ice, 20 minutes of heat, and always ending in 20 minutes of ice. That's gonna be his best treatment. No anti-inflammatories such as NSAIDs. Ibuprofen is an NSAID and non-steroidal anti-inflammatory. No curcumin, which is turmeric, and no fish oils. Other than that, if you're in like a large amount of pain, you can take acetaminophen, which is Tylenol.
That's my jam.
That's your jam. You can take morphine if you're Austin West. Right. That's all prepped for us. We'll get them going. And you talked about life the last time we were here, right?
We dove deep.
We dove deep.
Yeah.
We were talking about a bunch of stuff. Good. So this is going to be the supraspinatus. Your supraspinatus has a fascia. The fascia is like looks like a spider web, and it sits along the tendon and the bone. So your whole body has like a fascia. Like people think about it like plantar fasciitis.
Yeah.
The fascia is like a little web on your foot, and the supraspinatus has that. So usually we'll get a couple different angles into the supraspinatus.
I remember this.
I know what it feels like. This will go inside the AC joint itself. This one gets a little tender. Preston's anatomy is pretty good, so AC joint's gonna be right here. So we'll go in right here. Deeper, good.
Oh, yeah, that feels good.
Yeah, it feels great. Not so fun one. Right. Left sideline on your right. So spine of the scapula goes over here for your actual scapular, your shoulder blade. Go down the humerus, you kind of move the deltoid. He's got a small deltoid, but you know, get into there. And then what we'll do is shoot interarticular right here.
Oh, yeah.
Perfect. Great. Worth a little bit of pain for the result?
Oh, bro, trust me. That versus surgery, you're telling me six months recovery time. I'm like, that's 6 months.
Yeah, you're getting sweaty, man.
That's not me. That's like dripping.
It's dripping from the ceiling. It's getting wet in here. This is superior labrum up here. So labrum's like a little connective tissue that holds in that glenohumeral joint, which is like your shoulder joint.
Watched the John Wick last night. You seen that movie?
Mm-hmm. The third one?
So I started rewatching them, so I watched the first one again. That's how it worked. Oh,
Yeah, dude, right there.
oh man, that hurts. Holy crap.
Yeah.
Felt good. He goes into the vet because he's got like that cut in his stomach and he's got to staple it himself and do it. And I'm like, dude, if you can do that,
Yeah, screw that.
I can do this. Because that wasn't a movie, that was real life.
You're doing good. This one's double concentrated, so the first treatment was like single concentration.
Yeah.
So this one's a little thicker, so you might feel a little bit more.
It's already definitely feels tighter than it did last time.
So you gotta give him like a little gentle massage every day and tell him that you love him.
Tuck in his shoulder.
Yeah, you know, tuck him into bed and then feed him a glass of wine.
Feed it to me. Yeah, like
Grapes,
Yeah.
grapes too. I'll write a prescription pad. You don't need it.
I will put it down. Oh crap.
All right, brother. Take it easy down there. Ice, heat, and ice. 20 minutes of ice, 20 minutes of heat, 20 minutes of ice. Always end in 20 minutes of ice. If you do need to take acetaminophen, Tylenol, take that. Don't drink on acetaminophen and Tylenol. Ruins the gut. So remember that one. I'll see you back probably in like 4 weeks. We'll kind of see what your shoulder's doing. Let me know about ozone and kind of just symptomology.
Okay.
If your brain fog starts coming back, if fatigue starts lingering back, we'll get more treatments in. But if not, keep on all your supplements. We'll probably rerun labs in about in April. So we'll probably run it in like August, maybe closer to your birthday.
Yeah.
So
It'll be my birthday present to myself is that I'm healthy.
jab you up. Brother in. That's it. We'll see you in about a couple weeks. Take it easy getting up. Hey guys, that was a wrap with PRP for the left shoulder. So that was a rotator cuff issue that we did some PRP and prolotherapy for. So if you guys have any questions, call Melanie at the front and she'll get you scheduled up.